Hi, my name is Hema. I'm one of the students in the Central Queensland University, and I am doing this pitch for the purpose of my assessment 1 in Clinical Foundations for Practice 2. And my topic is the ethical dilemma in treatment with olanzapine. So, the first generation antipsychotics had a side effect of EPSC or extrapyramidal side effects, which actually affected the quality of life of the patients on them. So the second generation of antipsychotics were developed to avoid this side effect, in which the developers were actually successful. So the EPSC was got rid of when the second generation antipsychotics came into place. And olanzapine and clozapine are one of the mostly used antipsychotics in the second generation, out of which olanzapine is the mostly used one. So the second generation antipsychotics has numerous benefits, and it's actually really good for the patients, except for the side effect of adverse metabolic effects, mainly weight gain. The other side effects which are non-desirable are the insulin sensitivity is affected in these patients within the first 3 weeks of administration of olanzapine. And olanzapine also leads to, not only olanzapine, most of these second generation antipsychotics also lead to cardiac arrhythmias in the long run. So the weight gain is personally a problem for most of the patients on olanzapine. So the catch-22 of being crazy or fat is again affecting their quality of life, because it's affecting them emotionally with their physical figure, which is getting fat, and I don't think anybody would like that. So the patients themselves become non-compliant with these medications because it affects their quality of life. It affects their social life because they withdraw from their social life due to their physical appearance, which is caused by the medication. So this mentality leads them to be entrapped in a vicious cycle of coming to the hospital, getting treated, getting their mental state stabilized, and getting discharged to the community on olanzapine. So they're getting discharged on olanzapine and they become non-compliant with the medication. So most of them completely stop them because they don't want to gain more weight. They want to have their social life. And in turn, their mental state starts deteriorating again, which brings them back to the hospital. And they stabilizes again. And this goes on and on and on. And they're actually stuck in that cycle. So there should be a way out from this weight gain. So there are so many researches going on, and one of the rat model studies shows that beta histine, one of the antihistamines, blocks the hypothalamic AMP activated protein kinase activation, which is the cause of weight gain. So olanzapine acts on the hypothalamus and it acts on the AMP activated protein kinase. It activates that, causing the person to gain. So there was a school of thought that it's the genetics which is affecting the weight, causing the weight gain. But now it is overruled by this research finding that it is the effect on the hypothalamus by the olanzapine causing the weight gain. So in the rat model study, the beta histine is working. So in human trials, if the beta histine works, because beta histine is one antihistamine, even in long run, according to the researchers, doesn't cause any other problems. So if that's all true, that all turns out to be true, then it is going to be a blessing for the mental health community, including the treatment team and the patient, because the patient benefits from that. That when there is no weight gain and the antipsychotic works, the patient is going to be compliant with the medication and the treatment is going to be much better for the patient. and ask the nurses, because we will see the patients treated, their mental state stabilized, they go out of the door and they stay stabilized, which is the most desirable thing. And hoping for that better future, I thank you.